Hello, my name is Michael Burns, and I am a senior benefits consultant who works with CLM for their employee benefits program. CGI Business Solutions is the agency that I work for, and today we're going to walk through the benefits booklet, which encompasses all of the benefits on a high level that are offered to you as CLM employees for the plan year beginning January 1st, 2021. As we go through the booklet, there'll be information that there's additional information available from the various carriers, as well as the vendors that in fact offer these programs. However, again, today is more of a summary to go over the benefits as a whole. What's inside is outlined on page 2, so a table of contents. The eligibility for those of you that are now eligible for benefits. And we are going to jump into the medical insurance and walk through the benefits that are offered by Anthem Blue Cross Blue Shield. The medical plan that's offered today is an HMO plan. On this plan, you are required as a member to choose a primary care physician. However, the unique thing about the Anthem plan is that referrals to see contracted specialists are not required, and the network of providers extends across all of the New England states. So if in fact you live in New Hampshire and you'd like to see a provider for specialty service like dermatology, cardiology in this state, or in Massachusetts or in Rhode Island, you would refer yourself for those types of specialty services. The calendar year deductible on this plan is $7,200 per person, $14,400 per family. That said, the deductible does not apply to all services. It is specific services that are outlined in the summary of benefits, many of which that we will touch upon as we go through this presentation review today. The deductible responsibility that is yours as a CLM employee is $750 per person, up to $2,250 per family. So what this means is that of that $7,200 that Anthem has as their deductible, your responsibility as a member is $750, with CLM reimbursing the balance of $6,450 for an individual and $12,900 per family. The reimbursement is done through a program called an HRA, which is a health reimbursement arrangement. And this is something that is funded by CLM, and they do this on your behalf. So again, of the $7,200 as an individual, you will be responsible for $750 should you receive any services that are subject to the deductible, with the remaining $6,450 being paid for by CLM. And we will cover more details about the HRA and how it works later in the booklet. There is no coinsurance in the medical portion of benefits after the deductible, and the out-of-pocket maximum is $8,150 and $16,300 per family. The out-of-pocket maximum is the most that any one member or family as a group would pay for services throughout the 2021 period. For example, if you were admitted to the hospital and you hit your entire $7,200 of your deductible, you're paying for $750. The CLM HRA is paying for $6,450. If you had co-payments thereafter for office visits, prescription medications, Anthem is basically counting all of the dollars that you are contributing in your member cost sharing, which includes the HRA, to a maximum of $8,150 per person. Should anyone hit that limit, you would then be covered for the remainder of the calendar year at 100% without any cost sharing on your behalf for any additional services you may need. The lifetime maximum, there is no maximum. So regardless of the services that you may need, there is no maximum as far as the benefit dollars are concerned. Anthem will continue to pay for any covered services throughout the duration of the plan year. For office visits, preventative care, when the Affordable Care Act passed, the preventative care required that health insurance carriers cover things like physicals and a number of preventative screenings and services at 100%. Things like immunizations, mammograms, pap smears, colonoscopies, certain types of blood screening for cholesterol, diabetes. Those are things that are covered at 100%. Keep in mind when it comes to preventative care is exactly preventative. And what that means is if you are somebody who has never been diagnosed with any of the conditions that the preventative care screenings are looking for, then your lab work will be covered at 100%. But if you're someone who has high cholesterol or you have diabetes, some of those tests that you have done on a regular basis aren't really preventative anymore. Those, in essence, are used to track and to manage and to monitor your condition. Things like that would not fall under preventative care and instead be subject to the plan's deductible. For a primary care physician, as I mentioned, the Anthem plan requires that you choose a primary care physician. There are two options for primary care. There are preferred primary care providers and there are non-preferred primary cares. A preferred primary care is someone who has been designated by Anthem as having high value, low cost for managing healthcare. The practices that are currently a part of the PPC program with Anthem are the folks at Southern Hampshire Internal Medicine, the Wendy Wright nurse practitioners in both Concord and Amherst, New Hampshire, and also those at Derry Medical Center. So if you choose a primary care physician within those three practices, you'll have a $5 office visit copayment. And for any providers that are contracted with Anthem but not part of those practices, you will have a $35 copayment. The specialist copayment is $60. So if you were to see a dermatologist, cardiologist, that's where a $60 copayment would be your responsibility. The chiropractic care and acupuncture in an office setting is a $35 office visit copayment. And you'll note here that some of these services have an asterisk next to them, and I will cover why that is a little bit further along as we go through the benefits. Live Health Online telemedicine. This is basically the ability to more or less either Skype or FaceTime, if you will, with a provider, with a licensed physician in any state in the country for an urgent care issue. What you would do is hopefully you will set up your account before you need it, and you will, anytime during the year, 24 hours a day, 365 days a year, in any state in the country where you have an issue going on, maybe it's a cold, maybe it's an earache, maybe it's congestion, maybe you bruised your knee, anything like that, you have the ability, instead of going physically in person to an emergency room or an urgent care center, you can actually have a provider examine you and discuss the situation with you over a smartphone, for example, or over through a laptop that has a camera. And the cost of that service is $5 per visit. The unique thing about the Live Health Online is that these providers do have the ability to prescribe medications. So should you need an antibiotic, for example, these providers can, in fact, provide that for you. The urgent care and emergency room. So I'm going to start with the emergency room because emergency coverage is covered worldwide, whether in state, around the state, anywhere in the country, anywhere in the world. The way it works is if you go to an emergency room, you will be required to have services subject to the deductible. And then if you were to hit your deductible of the $7,200, it would then be $250 per visit thereafter. For urgent care, there is two different types of urgent care when it comes to in-person urgent care. And I say that because Live Health Online I reviewed is more of a telemedicine program. The independent urgent care facilities, these are places that are urgent care providers, but they're not owned by a hospital system or affiliated generally with a hospital type system. Places like Convenient MD, Clear Choice. These are places where if you go there and see a provider for urgent care, you will have a $35 copayment per visit. If in fact you go to a urgent care facility that is hospital owned, for example, Elliott Urgent Care, it's certainly going to be less than the emergency room. However, it is still more costly than an independently owned urgent care facility like Convenient MD. So you'll have a $75 office visit copayment, and then you'll have services that are subject to the deductible. For diagnostic x-rays and lab tests, this is really important because the unique thing about this program with Anthem is that they call this a site of service plan, meaning that depending upon where you go for services will determine, for some services, how much money you're responsible for. If you have lab tests at a independent lab like Quest or Nordics, that's part of the site of service program with Anthem, those labs, those blood work tests are covered at 100%. If you have any other blood work at a provider's office, if you have it done at a hospital, you certainly still can, but it will be subject to the deductible. And I want to give you an example here. We talked earlier about preventative care and about how there's screenings for things like diabetes and cholesterol. Those are things that are covered at 100% if you don't have those conditions today. However, if you're someone who's diabetic, maybe you're on blood thinners, maybe you're someone who's on a medication, maybe thyroxine or levothyroxine for your thyroid, maybe you're on seizure medication and you require labs to monitor those dosages of medications your provider is prescribing to you. You have an option, you have a choice to make. If you take those orders from your provider and you go to an independent lab like Quest, for example, you go there, they'll draw your blood, they'll send the results to you, they'll send your results to your doctor, and that blood work is free. It doesn't cost you a dime. However, if it's more convenient and you have the ability to have blood work done in a provider office or in a hospital, you certainly can. However, it will be subject to your deductible. So the choice is yours. It's your money. You work hard for it. You get to determine for certain benefits how you want to spend it. Granted, we always can't always make a choice, but when it's safe to do so and you have the option, you may want to consider an independent lab because it will certainly save you less in your out-of-pocket costs. When it comes to x-rays and ultrasounds, kind of the same concept. If you have your x-rays, ultrasounds, and even high-tech imaging like an MRI or a CAT scan, if you have these done at freestanding facilities that are not owned or operated by hospital systems, it will cost you far less. So, for example, if you have an x-ray, you need a chest x-ray. You need to have an ultrasound done. If you have it done at a freestanding facility like dairy imaging, for example, the most you'll pay is $125 per visit. However, if you have those types of tests done at a hospital, they'll be tracking towards that deductible of $7,200. For high-tech imaging, MRIs, CAT scans, $250 if you had it done at a freestanding radiology center. Again, dairy imaging as the example. Or if you want to have it done at a hospital, you certainly can, but it will be subject to the deductible. So again, site of service, meaning that the site that you have the procedure or the test done at will determine how much you as a member will be responsible for. These lists of providers that participate on the site of service program are available through the Anthem site. So I would encourage all of you to please go to the Anthem site, find these providers, know where they are, should you ever need them. For short-term therapy, physical, occupational, speech therapy, these are sometimes grouped as a category known as functional therapy. It is 60 visits combined. So whether you're using 20 of each or 60 of one or 30, 20, and 10, you'll have 60 visits a year at $35 per visit. For your inpatient admissions, whether it be for medical or for a behavioral health admission, it is subject to the deductible. So again, that's something that there is no site of service per se. It's just a deductible service. For outpatient surgery, on the other hand, again, we're back to that site of service ability to have procedures done at hospitals versus freestanding facilities. For example, if you were having a knee surgery or maybe a rotator cuff, and you can safely have that procedure done at a freestanding facility like BASC, Bedford Ambulatory Surgical Center, your cost on this program is $250 for that day surgery. If in fact you have that surgery done, might even be the same provider that's performing it, you have it done at, say, Elliott or Catholic Medical Center or St. Joe's, Dartmouth, you certainly can have it done there, but it will be subject to your deductible. So again, it's your choice on where procedures do take place. Not every surgery, in full disclosure, can be done at a freestanding facility, and you unfortunately may have some medical complexities that make it unsafe for you to have those types of services at a freestanding facility. But that's up to your provider and you to talk through. However, if it's safe to make that decision on where you can have that procedure done, some may want to consider a $250 location versus a deductible location. But again, choice is clearly yours. For mental health and substance abuse, categorically as behavioral health, inpatient subject to deductible, as I mentioned, and outpatient services, if you're seeing a psychologist, psychiatrist, social worker, $35 per visit, same as a primary care physician. For prescription drug copayments, the prescription drugs with Anthem, there is a 4-tier program that is offered to CLM employees. The first tier is tiers 1A and 1B, and the cost of those medications is $5 and $25. And these primarily are made up of generic medications that are either considered lower cost or higher cost. But again, typically generic, not always. But if in fact you go and pick up a medication on Anthem's drug formulary that is on a 1A or 1B, you will have a copayment cost share to you of $5 for tier 1A, $25 for tier 1B. The tier 2 medications are a $40 copayment. There is a $60 or 30% to $300, whichever is greater, or 40% up to $400 for tier 4. But here is a very important thing for you to be aware of. Although almost 80% of the medications historically that CLM employees and family members have taken have fallen into the categories of 1A, 1B, for the medications that fall into tiers 2, 3, or 4, there is a separate prescription drug deductible of $500 per person, up to $1,000 per family, that does apply to the medications, again, that fall on tiers 2, 3, and 4. The good news, actually the great news is that CLM, as part of this health reimbursement arrangement, they actually pay that deductible on your behalf when you have medications that fall into tiers 2, 3, and 4. However, I want to cover that in greater detail further along in the booklet when we actually cover and dive into the HRA a little bit deeper in how it works. The biweekly and pay period contributions from left to right are noted below. Single, employee and spouse, employee and child to children, and family. And again, the asterisk is noting where the benefits are that are supported and paid for by CLM via the HRA reimbursement. The following page is, again, recapping the preferred primary care providers. These are the, Derry Medical Center, the Southern Hampshire Internal Medicine, and the Wright Associates and Wendy Wright practices of nurse practitioners, where if you choose them as your primary care physician, you'll have a $5 copayment versus the $35, and this just gives you some additional information about those providers. For Life Health Online I already had spoken to, which was the urgent care telemedicine of the $5 copayment for those that want to have a face-to-face over the telephone or over a computer with a provider for an urgent care that is not situation that's not life-threatening. Sydney, Anthem has a member application called Sydney, and this is an artificial intelligence application. Artificial intelligence tends to be the buzzword these days, and what that simply means is the more you utilize the member app, the more it gets to know you. So if you're someone who likes to pull up your ID card more often, when you access Sydney, it'll learn to open it first. If you're someone who likes to look at claim information more often, it'll learn to go to claims and open that more, as soon as you log in. But what's neat about Sydney is it really does get to be a personal app, where if you're someone who's due for a mammogram, a pap smear, maybe you're due for a colonoscopy, it will send these types of reminders through that app. And again, it becomes really specific to you. For those that are going to use the Sydney app on your smartphone, or you're going to download it onto your computer, a couple of helpful hints. Number one is that I would go to anthem.com once you receive your member ID number, and I would set up an online account. where you can go in and create your username, your password, and then you would download the Sydney app onto your smartphone, and it'll make logging in a lot easier. So online registration first, Sydney download following that. The second thing is that it is really important that if you're going to look to use Sydney as a resource for you, that you go in and you populate all of your personal information as soon as you can. You want to list out your emergency contacts, your physician's information, your specialist, your drug allergies, anything like that, because I can assure you of one thing. If you need urgent care, you need to access, someone to help you, the last time you want to, or the worst time to do it is when you have to now create and download the app and load all your information when you're not feeling well or when there's some sort of crisis that you're dealing with in front of you. So please, being proactive versus reactive is critical in making things easier, to get help when you need it. And you folks know this. You work in behavioral health. You know how important it is to plan ahead, to not be reactionary. So download the app, please. Create it, enter your information so that everything's there at your fingertips when you need it, and it'll make the experience and the usefulness of the app that much better as time goes on, and you may need that. For Blueview Vision, so fortunately, Anthem has a great program where for anyone who has enrolled in the medical plan, you have an embedded meaning included, vision program. And the way it works is that for adults, you have a routine eye exam every 12 months, $20 copayment for your routine eye exam. And it's interesting, from an eye exam perspective, it's almost 100 different diagnoses can be actually picked up on an eye exam. And it's very easy. You have your routine eye exam, whether it be a lens crafters or any other participating in-network benefit provider with Anthem, and you pay $20 and have your eye exam. The folks at Anthem, their plan also covers allowances, $100 for frames, $100 for contacts, one or the other every other year, and also some great discounts off of lenses and so on. If your provider is not part of the routine vision network with Anthem, that's okay. You could still see them, but it would hit your out-of-network benefits. So if, in fact, you're going in-network, for example, for a routine eye exam, $20 copayment. If you go out of network, it's $48 that you would pay and then get reimbursed by Anthem. But again, it's always advantageous to stay in network when you can. It'll be lower cost sharing, and these are providers that are contracted with Anthem, and the connection from a provider side as well, as far as the data that goes into the algorithms that monitor the different diagnoses and so on, are certainly tremendously advantageous to those members who have Anthem, where the vision exam feeds a lot of the claim details about diagnoses and treatments and medications and so on. One thing to note is that on the vision program is that for those of us who have children that are on our plan that are under age 19, the benefits vary slightly. Not the eye exam itself covered every 12 months, but some of the allowances are actually a little bit richer for some of the benefits. So I encourage you to look at the Anthem information and compare and look at those differences so that you're aware of those when you go to receive those types of services and are looking for different types of cost sharing information. So I mentioned earlier around site of service about, the location of where you go determines kind of how much you pay for certain services. I mentioned x-rays, I mentioned MRIs and surgeries. So there's a program available to all of you and to your families that are enrolled in the Anthem plan called Smart Shopper. And it says here, it's easy to use. It actually is really easy to use. So Smart Shopper is a program that does a couple of things. If in fact your provider, say they scheduled an MRI for you to have done at one of the local hospitals, they will call, they will get the authorization from Anthem, they will let you know that your MRI is scheduled and your appointment is this date, and it is something that is going to be subject to deductible because, again, you're having it scheduled at a hospital location. Once it's scheduled, you have the ability. And what I love about Smart Shopper is that Smart Shopper is a choice, it's not a requirement. But you have the ability as a member to call the folks at Smart Shopper, which are local. They're actually in the Manchester area, New Hampshire. And you can call them and say, hey, I have an MRI scheduled on this date at Elliott Hospital, for example. They will look and they will respond and say, okay, we see here that you can have that MRI that's scheduled at Elliott Hospital. And did you know that the average cost of an MRI at Elliott Hospital is, say, $1,500 or $1,600? We can give you the option. If you'd like us to help you, we could reschedule your MRI to a freestanding facility. And by doing so, it would cost you $250. Would you like us to help you reschedule that appointment? Then you, as the member, have the ability to make that choice. You can say, no, thank you. I'm actually going to stay and keep it at Elliott. Or, yes, I would like you to help me reschedule it to a place that's still high quality, but lower cost. They will then help you reschedule that appointment at that freestanding facility. And a couple of things happen when you do that. Number one, it gives you some insight as far as like how much do some of these tests cost? How much does a day surgery cost? Another reason why people use Smart Shopper. It also gives the ability to save money, right? Because you're talking about a deductible versus a copayment. And that is a significant difference. In fact, I'll take it a step further. I know that sometimes you may have a MRI that is supposed to be done every 2 or 3 years because you've had a history of cancer. And I will guarantee you that there are people out there that do not get the MRI done every 2 years, for example, as they should. Instead, they might do it every 3 or every 4. Why? Because it's unaffordable. They can't afford to pay $1,500 or $2,000. So instead, this is an option for you to be able to be a better consumer, to get whatever procedure or testing that you need at a lower cost. Not all the time, but in cases like MRIs or CAT scans, sure, there is an option here. And also, it gives you the ability to be rewarded by Anthem. You'll see on the right-hand side here, if you had that MRI scheduled at Elliott and you rescheduled it to, say, Derry Imaging, not only did you save money from probably $1,500 to, $250, which is your copayment, but now Anthem's going to send you a check in the mail to your house for saying, hey, thanks for being a great consumer. And you'll see here the different types of rewards can be pretty significant, up to $150, $250 just for being a good consumer. But again, the choice is yours. It is your money. You work hard for it. You get to determine where you want to spend that money. And Smart Shopper allows you to make that choice and also gives you the inside information on how much things are and how much they are one place versus another place. So again, great program, completely optional. I hope people will take advantage of it. For the health rewards program, so one of the unique things about Anthem that is great is that when it comes to rewards and reimbursements for taking care of yourself and for doing things that in most cases people are doing already, Anthem allows you to earn in rewards and reimbursement up to $1,100 per calendar year. Now, what's even better about this is not only do they allow you to earn up to $1,100 in that, but also your spouse or partner can earn up to $1,100 as well. So again, both of you can take advantage of this if you are married or you have a partner on your plan that is through Anthem, through CLM. The way it works is that you'll receive your rewards through a reloadable debit card. It's a rewards card. And you can see the status of the program. Again, Sydney is a great way to look at that and to see where you are and how many dollars you have. And I'll explain a couple things about this now that's pretty neat. So if in fact you are someone who has a chronic condition, so up here on the left-hand side talks about asthma or diabetes. Anyone who has asthma or diabetes, you know what? Education is everything. Being able to understand your condition, knowing how to manage it, is certainly the way to stay healthy and obviously to live longer and to avoid emergency room visits and so on. You can earn up to $300 a year in a nurse-centric program. You get $100 for participating in an educational program. you get another $200 for just completing it. And you know what? This just benefits you. It helps you become a better, as crazy as it sounds sometimes, a better diabetic, a better asthmatic, because you know how to manage your care. And you're making some dollars as rewards from Anthem for saying, hey, thanks for caring about yourself. Thanks for trying to stay healthy. For well-being coach telephonic rewards, same type of thing. $100 for participation, $200 for completing the program. So let me give you an example. On the right-hand side here, flu shot and wellness visit reward, up to $50. So think about this for a second. We're all in healthcare. You are in healthcare. You work for CLM. You know, no one has to tell you the importance about preventative screenings, having an annual physical, getting a flu shot. Those are things that generally most people who work in healthcare do automatically. It's like brushing your teeth sometimes. It's just what we do to stay healthy. If you in 2021 have your physical exam, which I hope you do, you get a flu shot. Maybe it's October, November, you have that flu shot. What's going to happen is the second that you have those two procedures, Anthem is going to trigger in the system, and it's going to know you have them. And if you have registered under the health programs section of your Sydney app, Anthem will then send you a debit card loaded with $50 on that card. That is a MasterCard. You can use it to buy groceries. You can use it to buy gasoline. You can use it to buy yourself a new outfit. Whatever you want to spend that on, wherever that location is or merchant is that takes MasterCard, you can use it there. That $300 we talked about earlier, $100 for enrolling, $200 for completing, it gets loaded on there as well. So whatever kind of category you do first is what triggers you getting that card. And again, use it, don't throw it out. It's a reloadable debit card. I mentioned earlier, you and your spouse or partner get this benefit. I will answer the question I get asked all the time is, well, if I do this and my wife or husband does this, like, does the money go into one pot? The answer is no. You have your card, your spouse has their card. They are not commingled funds. You can spend your money and your spouse or partner can spend theirs. And it is just a great benefit. And again, these are things that sometimes we're doing anyway. Future moms, if you're having a baby, you can earn up to $200 for just learning about the many things that you may want to know, becoming a mom. And again, this is something available to you or you and or your spouse and partner. So again, both of you get this benefit. Now, there's another component of this. So they called it a reward and reimbursement program. The reimbursement is around gym membership. And I know that a lot of people join a gym, especially after January, New Year's resolutions. And the way it works is that if in fact you join a fitness facility, Anthem will reimburse you up to $200 every 6 months, as long as you go and you attend that fitness facility, that gym, at least 35 times every 6 months. So they'll reimburse you up to $200 twice annually. So if you're someone who goes to Planet Fitness, for example, and you're paying $10 a month, you can get that entire $120 covered just by going 35 times every 6 months. And again, it's up to $200 every 6 months for you and for your spouse. But you know what's really incredible about this? Any of our dependents that are age 18 or above that are on the Anthem medical plan, they're your dependents, they also get that gym membership reimbursement. So if you're someone who has, one child, 2, 3, 4, everyone will get that aspect of this reimbursement program. So again, just to be clear, the rewards program is you and spouse or partner. The gym reimbursement up to $400 is you, your spouse or partner, and any dependents age 18 or above. So again, a great program and a way to hopefully keep people healthier and happier. There's a number of health rewards activities that give the ability through a point system to earn up to $150. So certainly you can take a look at this information through your Anthem program. And we're going to go through the health reimbursement arrangement because this is really an amazing benefit that you get as employees of CLM. And it's something that is extremely gracious on their part for sure. And the way it works is that eligibility employees, their spouses, and dependents that qualify under the IRS guidelines for tax purposes and that are enrolled in the medical plan with Anthem are eligible for the HRA. So what is the HRA? It is a health reimbursement arrangement. What does that mean? It means that this is something that your employer offers its employees who enrolled on the medical plan to help offset some of the costs that are required that without an HRA would be solely your responsibility as members of Anthem. So for starters, each employee will receive an HRA benefit card to be used when purchasing medications. If you recall, I mentioned earlier that Anthem has a 4-tier prescription program. So medications are either going to be on tiers 1A or 1B, which is considered tier 1, tier 2, tier 3, or tier 4. For those of you who are taking medications that fall onto 1A or 1B, there is no drug deductible. For tiers 2, 3, and 4, there is. And again, I'm going to cover this a little bit in greater detail in a moment. The medical deductible I mentioned early on. The medical deductible is $7,200 per person, $14,400 per family. That said, what CLM is requiring of you as their employee is that for each member of your family would be responsible for the first $750 of the deductible should you have services that are subject to the deductible. Again, things like inpatient admissions, maybe a surgery at a hospital, maybe a CAT scan, maybe testing, blood work, things that go towards the deductible. You are responsible for the first $750. The first $750, that does not mean each time you need something, to be clear. That means that beginning January 1st of 2021 through December 31st of 2021, the most you would be responsible for specific to your deductible is $750. Up to a maximum, if you have 3 or more people in your family, $2,250 per family. So what happens to the balance? I said your deductible is $7,200. Your Anthem materials say that it's $7,200. Who pays everything after $750? CLM does. They'll pay $6,450 of your deductible after you hit that $750 to make sure that you have met your deductible for the year to a family maximum of $12,900, again, paid by CLM. Now, if you remember, when we were going through the benefits, there were certain services that I had asterisks next to when it came to office visit copayments. So the way it works is that your office visit copayments, as I mentioned, for a PCP that is not part of the preferred provider program, is $35. The way it works, and your chiropractor, acupuncturist, those are $35 copayments as well. The first 8 visits for each member throughout the year, although Anthem is saying $35 is your copay, your provider will collect $35 because that's your copayment. When that happens, a data feed comes over to CGI, which again is my employer, and we administer this HRA on behalf of CLM. And what we're going to do is when that claim comes through, and again, it's a high-level claim, there's no specific personal details. It'll say that, ABC person went to XYZ provider. There was a $35 copayment. We, in turn, will then send you a check in the mail for $15 for the first 8 visits for each member, maximum of $120. So your copayment, $20 for the first 8 visits. The first 8 visits for your spouse, for your children, $20. Specialist copayment. CLM is going to reimburse $40 of each $60 copayment. Again, your cost, $20 for the first 4 specialist visits. Again, for each member, you, your spouse, your children, up to $160. So again, when you're looking at the benefits, there are benefits that Anthem is saying, these are the benefits that your employer purchased. There is now an HRA that is in place that is outside of Anthem that is telling you that, yes, although Anthem says that these are your benefits, here's really what it means for you for certain types of benefits. For your emergency room, so we mentioned earlier that the emergency room is subject to the deductible. If you go to the emergency room, it is going to go towards that deductible. The average cost in the state of New Hampshire for an emergency room visit is about $1,500 per visit. So if you go to the emergency room, it certainly is a more costly place for service. However, people get sick and sometimes you have to go. Please don't ever hesitate to call 911 or go to an emergency room thinking, oh, wait a second, how much is it going to cost me? If you need to go, you go. If you're safe to make decisions like, well, maybe I'll try telemedicine, or maybe I'll try an urgent care like a Convenient MD, or maybe an Elliott Urgent Care, or others that are hospital owned. When it's safe to make that choice, you do it. But when you need to go to the emergency room, you go, because people's lives are at stake. And no one wants to make that mistake, especially for us or for one of our family members. But if you did hit your deductible and you then went to the emergency room after the deductible of $7,200 was satisfied, again, you're paying $750 with CLM paying the balance. If you pay that $250, again, the HRA is going to kick in, and the health reimbursement arrangement, aka CLM, is going to send you $50 for every emergency room to help offset that cost. So again, these are all benefits that are available to you as CLM employees. Now, pharmacy reimbursement, I want to spend a couple minutes here talking about exactly what this means. So again, as I mentioned, CLM will reimburse the $500 prescription deductible for you. So if you have a medication, you're an individual, and just say you have a medication that falls on tier 2, maybe it's tier 3 or 4. CLM, you go into the pharmacy and they say that your medication is X amount of dollars. You know it's not $5 or $25 because it didn't go towards your 1A or 1B. Know that you will hand over the HRA card to them, which we have issued to you on CLM's behalf. The pharmacy will go ahead and they will process that card, and it will pay for that $500 prescription drug deductible for any medications that fall on tiers 2, 3, or 4, up to $1,000 per family. So if it's 2 or more in the family, it's $1,000, $500 each. Again, not applicable to tiers 1A or 1B. So what does this mean? What it means is that during that $500 deductible period where drugs are tracking towards that $500 deductible, what does it mean for you? Great news. If you're on 1A, we know it's a $5 copayment. If it's on 1B, we know it's a $25 copayment. But amazingly, if your medication falls on tiers 2, 3, or even tier 4, despite the fact that your tier 2 copayment should be $40 after the deductible, despite the fact that it should be 30% up to $300 for tier 3 or 40% up to $400, your cost during that $500 deductible period is $25. That's how much you're going to pay for those medications on tiers 2, 3, and 4. Again, during the deductible period. The deductible, I mentioned earlier, there are certain things that are per calendar year, like your medical deductible, or when I mentioned, the emergency room goes towards the deductible. Those are per calendar year. So if one member, if you are on a plan by yourself, or you're just someone who happens to take medications that are more costly, that fall on those higher tiers, once you hit that $500 for the year, that is over. That deductible satisfied for the year, just like the medical deductible. Once you hit that $7,200, that's it. You're then now past the deductible period. So what happens after I hit that $500 deductible for my pharmacy? Well, for coinsurance, and in particular tiers 2, 3, and 4, I mentioned that in the deductible period of satisfying that $500, your copayment would either be $5 or $25 across the board for tiers 2, 3, or 4. Once you hit that $500 deductible, and if you were to go then pick up a tier 2 medication, your copayment, just like is outlined on the high-level summary at the beginning of this booklet, it's going to be $40. So you were paying $25 for tier 2, but you've now satisfied the deductible. It's now going to be a $40 copayment. For tiers 3 and 4, again, not to reiterate too much about the 30%, 40%, $300, $400, your cost, $75. That is going to be your copayment for any medications you need on tiers 3 or 4. So again, CLM, the HRA that they have in place for you as employees and for your family members is amazing, because they are picking up a significant portion of the cost sharing that without the HRA would fall on you and your families to pay on your own. So again, a great benefit that they offer as an employee of CLM. So for dental insurance is offered through Anthem as well. So there are two options that you get to choose from this year for 2021, just like 2020. And there's a high option and a low option. So both plans are offered to you, and you get to make the choice based on which is best for you. You'll see from left to right at the top, there's preventative services, basic services, and major services. Preventative services, again, cleanings, exams, they specify the specifics here below, and certainly within the Anthem information specific to the dental program, they outline all the benefits. But it's your preventative services, just like your physical exam and the medical, they're covered at 100%. Basic services on the high option plan are covered at 80%, 70% on the low option plan. Maybe you need a filling. That's where that would fall. Major services, crowns, for example, denture and implant, it's going to be 50% covered by you, 50% covered by Anthem. And you'll see at the bottom here, another difference between the two, and really what's driving the difference between the two is calendar year deductible on the high option is $0. There is no calendar year deductible that you need to meet before those benefits above kick in. On the low option plan, there is $25 per person, $75 for a family. The contract year maximum, what does that mean? That means what is the most that Anthem Dental is going to pay for services of the portion that they pay? $50 and $100, regardless of the plan that you're on. If you choose one plan and next year CLM decides that they're going to continue offering two plans, you then can make the option to choose the other plan or stay in the one that you're in today. There's some features of the plan, carryover, network boost, etc., that are outlined below here. The way it works is that, for example, on the carryover, there's an opportunity here that we know that you have $1,500 a year. However, there are some benefits to the plan where if you spend, like less in dental claims than what Anthem specifies, they'll give the ability to roll over a portion of that $1,500 into next year. So, for example, if it's a few $100s, they let you roll over. Instead of having $1,500 next year, you'll have $1,800 in my example. But again, Anthem will outline all of these specifically within their program details. The cost of the high option and the low option for dental is listed below from top to bottom. And you'll see here, there's not a tremendous difference. But you know what? Every dollar matters when we're talking about benefits. And it's nice to have a choice, because a lot of times, employees, you don't have a choice. It's one option and that's it. So having a high-low, certainly an option for you to consider which one is best for you and for your family. For group term life insurance, who's eligible? So anyone who is a full-time benefit employee, considered on the plan and benefit eligible, is eligible for the program for life and for accidental death and dismemberment. The way it works is that this is something that is 100% paid for by CLM. So the employee life benefit is 2 times your annual salary, rounded up to the nearest $1,000, with a maximum benefit and a guaranteed issue limit of $200,000. Age restrictions, one to note is that the benefit reduces by 50% at age 70, and all coverage terminates at retirement. This, again, is something that is employer paid. You don't have to contribute anything, and you will automatically have this benefit 2 times your annual salary, rounded up to the nearest $1,000. One thing to keep in mind, and I always remind people when it comes to life insurance, is that it is critically important that you sometimes think about who you are putting down as your beneficiary. Unfortunately, life circumstances change sometimes. Sometimes it's marriages, sometimes it's divorces, sometimes maybe there's a child that's been born, and you may want to change who that money is going to. And it's just keep in mind there have been times where somebody has passed on, and those dollars go somewhere where maybe they probably would have changed had they you know, called and checked and made that change of who the beneficiary is. So again, it's important, especially when you have a family who you're going to try to help support if unfortunately you're not able to be here anymore for them. So again, I apologize for being morbid. But this is a reality that unfortunately not everyone likes to talk about or think about. But I want to remind you of it because it's important. Moving on for disability. So there are two types of disability insurance, and great news for you again is that this is something that again is paid for by CLM. Doesn't cost you anything. So the way it works is that for short-term disability, there's an elimination period. What that means is if you are out of work for a specific amount of days, so 8 days you're out of work, the coverage kicks in. And the way it works is that the CLM program of short-term disability, and again, this is something that is also provided through Anthem, they will cover 60% of your basic weekly earnings minus any other income benefits you may have to a weekly benefit of up to $1,000. So that's the maximum that they will pay, up to $1,000. And that continues for 13 weeks. And you'll see the definitions of disability and earnings. And on the short-term disability, there is no pre-existing conditions. So just know that you have 13 weeks should something happen and you need to be out of work. So what happens if the 13 weeks comes and goes and I am still out? What does that mean? How am I going to support my family? There is long-term disability, and it kicks in immediately following short-term disability. The way this works is slightly different in that on the short-term disability, it was paying a maximum weekly benefit, so it's like weekly paychecks, whereas on the long-term disability, it's a maximum monthly benefit of $6,000. So that's the most that they will pay out. And you'll see here some of the specifics that is to the normal Social Security retirement age. It goes over again the definitions and also references some pre-existing condition language here as well. Again, the important thing to take away from here is that your life, your short, and your long-term disability are covered by CLM at no cost to you. For Employee Navigator, so for those that are actually using the Employee Navigator, which is a benefits platform, that is how you as an employee of CLM are going to elect your benefits, regardless if it's open enrollment for the October 26th through the November 20th period of 2020, looking ahead to 2021, or if you're a new employee now that's now become benefit eligible. The process is going to be the same. So if you follow the steps here, you can go in, you can create your account and your password, and then you can go ahead and elect your benefits for the 2021 plan calendar year. And once you elect your benefits, it will electronically submit that information over and enroll you into the different programs that are available to you that you elect. For flexible spending accounts, this is really important, and I think that sometimes not enough people take advantage of flexible spending accounts. So at the top here, it talks about eligibility, who's eligible to participate, the benefits that you receive. So the FSA it's a flexible spending account, and there is a healthcare reimbursement component. So think of the FSA as an umbrella, and under that is healthcare reimbursement. What this means is that the Internal Revenue Service allows you as an employee of CLM to set aside up to $2,750 per calendar year to pay for approved costs that are out of pocket for you. So, for example, we talked about your $35 co-payments. We talked about your $750 deductible. We talked about your prescription co-payments. But think about, things like vision. How much were your eyeglasses the last time you had to buy a pair of prescription, glasses? What about contact lenses? What about contact lens solution? Did you need a hearing aid? What about batteries? What about the cost that you had to pay for your filling or for your dentures or for your office visits, anything associated with your medical plan? The way it works is that if you decide to participate in the flexible spending account, again, you can choose up to $2,750, whatever amount you elect to put into this FSA account. CGI is going to provide you with an FSA card, so a flexible spending account card, and actually it is combined with the HRA card for the pharmacy. And the way it works is that if you're someone who makes $35,000 a year and you put $2,000 into your flexible spending account for healthcare reimbursement, instead of being taxed on $35,000, you're now taxed on $33,000. So you've now decreased your taxable income. The best news and the best part, I think, about a healthcare reimbursement FSA is that whatever amount of money you elect is available to you right away as soon as your eligibility kicks in. So, for example, for those that are electing money right now during open enrollment for 2021, come January 1st, if you elected $1,000, $2,000, or the full $2,750, guess what? That full amount is available to you on January 1st to use for any qualified expenses. And this is just a sample of what can be used for flexible spending healthcare reimbursement. The way it works is whatever amount you decide to elect will be divided up through the pay periods throughout 2021. And think of it as an interest-free loan. CLM is putting up that money for you. You will pay it back over the pay periods throughout the year. But the great news is that that money is available to you right away. That money, that card, it's like a debit card that's loaded with whatever amount that you've elected that you can now use for any of those types of expenses that you may incur throughout the year. So again, it's an interest-free loan. The one catch that is extremely critical is that on a healthcare reimbursement FSA, the IRS, not CLM, not Center for Life Management, the IRS says that whatever amount you put into this bucket of kind of tax-free money, if you will, must be used during the period that you're electing it for, which would be 2021. With the exception is we will allow you, the IRS is speaking now, to roll over up to $550 of unused money to 2022. So if you've never used a healthcare reimbursement FSA, please be conservative. You don't want to put too much money in here at the end of the year, lose money to that gets forfeited per the IRS. There's ways you can spend it. There's a healthcare reimbursement FSA store you can go to and purchase different things. But the most you ever want to roll over is up to that $550. But again, if you know you have an upcoming expense, maybe someone has a surgery, you know you're going to pay that $750 for your deductible. You know that you have prescription drug co-payments. You know that you have office visits that are going to be coming up. And maybe you're having a surgery and you know you're going to go to physical therapy for X amount of visits. Today, without that healthcare reimbursement FSA, do you want to know what happens? You open your wallet, you take out that money, or you use a credit card, and you are paying for that with after-tax money. The federal government has already taxed your paycheck. The Social Security has already come out of your paycheck, and you're now taking that money out of your wallet that has been taxed. If in fact you use the healthcare reimbursement, that money is coming out pre-taxed. So let me give you a simple kind of math example. If you were to take $1,000 out of your wallet to pay for, say, a deductible and some prescription drugs, it's exactly what I just said. It's $1,000. If you took $1,000 out of your paycheck pre-taxed, it's more like $750. So you just put $250 of your hard-earned money back in your pocket, not Uncle Sam's. So again, it's a way that you can benefit yourself from a tax perspective, have the money readily available when you elect it. However, it is a use it or lose it So again, please keep that in mind. Under the umbrella of FSA is also dependent care. Dependent care is referring to allowing you to set aside pre-tax dollars for things such as caring for children under the age of 13 or caring for elders that are your dependents. And the way it works is that the IRS allows you to take out $5,000 as a maximum, so it's up to $5,000 that you can set aside in a dependent care account. The way it works is that if in fact you elected the full $5,000, just like the healthcare FSA, they will take that $5,000 divided over your pay periods throughout the year, and each time you get paid, that $5,000 will be divided up over the 26 pay periods if you're paid biweekly, and they will take that money back and it'll put it into a dependent care account. You then use that money on a pre-tax basis to pay for your dependent, care. And for example, if you have a child that's in nursery school or preschool, and again, it does exclude kindergarten, which is specified here. If you're paying $250 a week, let's call it $1,000 a month. $1,000 a month, you are taking, if you don't have a dependent care FSA, you're taking $1,000. You know where I'm going with this. It's going to be the same thing. You're taking $1,000 out of your paycheck that's already been taxed by the federal government, by Social Security, and that $1,000 is $1,000. If you had that $1,000 taken out in a dependent care FSA, that $1,000 just became $750, and there's up to 5 of those. So think about the tax benefits of a dependent care flexible spending account. Keep in mind a couple things about the FSA. Number one is that the dependent care FSA is your money in that it is only available to you as you contribute it throughout the year. So unlike the healthcare FSA, where if you elect $2,000 in my example, I believe I used, it's available on day one and CLM fronts that for you. The IRS does not allow employers to front the dependent care dollars. So if you're putting $100 a week, then each month, for example, 4 weeks, in that month, or you putting $200 rather every other week, $400. You have $400 available pre-tax to use to pay for your child care. So again, it is something that as you put money in, you then have that money available. There's 2 ways that you can utilize the dependent care. Number one is you can reimburse yourself. So if you paid $1,000 in a month and you had $400 in there in the month of January or February, you can then take up to that $400 back towards that $1,000 you paid. Or if you have a daycare that accepts credit or debit cards, you could actually swipe your card at their billing office or use it and put it on your form or however your billing platform is for that daycare, for example, and they in turn can just charge the card. But again, the key differentiator between the flexible spending account that is healthcare reimbursement versus dependent care, healthcare reimbursement is available, whatever you elect is available on day one. The dependent care is available only as you contribute to it. However, both accounts have that use it or lose it. There is no carryover as of right now for dependent care FSA. So if you put the full $5,000 in there and you don't use it, that money does get surrendered per the IRS. Again, not a CLM, we're taking your money. It is an IRS requirement that the money gets defaulted. The places that you are using this money at need to be legitimate businesses. So they have to have a tax ID number. They're going to report that that you paid X amount of dollars, and it's going to sync up with your paycheck and your taxes to show that you took out X amount of dollars for dependent care. So again, it can't be if you're using a babysitter a couple times a week to get out of the house to go to dinner, you cannot use dependent care dollars for that. It has to be legitimate, underage 13, and you're using it to pay for things that are like nursery schools and preschools where they are filing to the government as well. And again, read through the dependent care options for reimbursement, because again, this is a great way that you can put more money in your pocket and less money in the government's. For the Employee Assistance Program, so Coastline EAP, this is another feature of CLM's benefit program that they pay for. I don't have to tell any of you that work for CLM how important it is to have a resource to be able to outreach to when life gets a little bit challenging. You'll see here whether it's legal assistance or financial assistance, dependent care, crisis consultation, just resources. These are reasons why you can outreach to the EAP program. It doesn't cost you a dime. It's completely confidential. It has nothing to do with CLM as far as data goes. This is between you and the provider, and they can hopefully help you with any situations that you're struggling with. So again, we hope that people will take advantage of this. For 403B, I think for most people, I don't know anyone really that says that I have enough money to retire and I'm going to be extremely comfortable. So I think the more that we do planning ahead and trying to save where we can is always great. We always want to make sure that we have enough money, hopefully, to retire someday. So there is a 403B plan that's available to all eligible regular full-time and part-time employees of CLM. So if this is something that you are able to contribute to or to learn more about, please contact Human Resources and allow them to give you that information so that you can better prepare for hopefully a happy and healthy retirement. For holidays, CLM does observe many holidays. You'll see here from left to right the different holidays that are recognized. The one that I found really unique and I thought was amazing was employee's birthday. So on your birthday, that is considered a holiday to CLM. So you get to take that day off and hopefully do something fun and enjoy, the same as you would any of the other holidays that are noted here. For customer service numbers, this is just a quick reference for the medical and dental, the life and disability for Anthem. Flexible spending accounts, again, CGI Business Solutions, which is the company I work for. Our web address is here and also our phone number. Any questions regarding flexible spending accounts, please outreach to us, including the HRA program if you have a question on that. The EAP program we just reviewed for Coastline was above, but it's also here as well, and their web page as well. And again, my name is Michael Burns. I work for CGI Business Solutions, and CGIBenefitsGroup.com is my email address. My phone number is here, and also on this account, I also work with Stephanie Ewell, who has worked with CLM for many years now as the account executive, and certainly outreach to us with any questions or additional details that you need. We are here to help. We are located in Auburn, New Hampshire, so we are local. We are very familiar with the provider network, with the benefits, with the carriers. So please outreach to us when you need us, and we hope that this has been helpful to you in understanding your benefits. I know that this is a lot of information for you to listen to, but hopefully you can refer back to it should you need to gain more information on any particular area. The last page here of the benefits booklet is about COBRA and health insurance marketplace options and some of the required information that we need to share with you. And in closing, again, I want to thank you very much for taking the time to listen to this review of the benefit booklet. I encourage you to access the information that's available from the carrier specifically about certain benefits level information for more detail. And I really, again, appreciate you taking the time to listen to the presentation, and we'll look forward to hopefully seeing you soon. And again, it's a fantastic package that CLM is offering, and we hope you feel that way as well. So thanks so much.